Hello and welcome to the November 26, 2024 Health and Ed Committee. And thank you all for coming out on a holiday week. This is such a glorious time of year. Fortunately, we have a light agenda, but we also have one budgetary item that's fortuitous that we meet so that the health department can maintain a grant that we already signed into contract last year, but it needs to be updated. Having said that, Ms. Hill, call the roll, please.
Commissioner Oliver?
Present.
Commissioner Davidson?
Here.
Commissioner Wilson?
Here.
Commissioner Boyd? Hope you're doing well. Commissioner McMurray?
Yes, I hear.
Commissioner Gooch?
Hello.
Chairman Dodd?
Here.
Thank y'all.
You are quick-witted, Commissioner Gooch. Any public comments tonight? The first item on our agenda tonight is the Health Department by Director Byron Cumbie. And Byron's going to update you guys on a grant. There's a memo of understanding to make sure that the grant stays in our coffers. And so we'll let Director Cumbie do that. And when the Health Department is finished, we will review our minutes from last month. Vice Chair Wilson just reminded me. So Director Cumbie, go ahead and we'll pick up the minutes next.
Thank you, Mr. Chairman. So hopefully, provided on your SharePoint, you've got quite a few documents from us. This is in regards to a request that came from the Commissioner of Health. Basically, it's a way of affirming that the ARP funding that has already been set aside did not expire on December 31st, and so that has to be obligated. So in short, I'll try to make it in short, but hopefully you did read the letter from the commissioner. He requests that every county, all 95, confirm that the ARP funding that has already been approved by our commission is still obligated and does not roll back to the federal government by the end of the year. So this MOU was prepared, and then he asked that it be reviewed by our county attorney. We did that. We had Mr. Christensen review it. Since it's also being signed by the mayor's office, we asked Eric Hennessy to review it as well. And then Director Smith confirmed that the numbers were there. He wanted to assure us that the money is set aside, already allocated in our budget. This is no new funding, anything like that. This is, again, just a kind of a confirmation that they're asking to be done. And we totally appreciate your participation on it, and I'll be glad to answer any questions if anyone has any.
I have one. Just a super brief explanation of what you intend the funds are for. Are they for brick and mortar? Are they for capital? And what is our grant match?
Okay, so this is in regards, we have a couple of pots of money. This is in regards to the ARP funding, which was the $450,000 grant with a $150,000 grant from the county. That is to go towards capital improvement. In our case, we have a couple of buildings, and our building here in Murfreesboro is now 22, 23 years old, and our HVAC is on its last legs. So unfortunately, as much as we would like to do something visible and have something very apparent, we are going to redo all of our HVAC. And so that's going to take up quite a bit of the fund, if not all of it. We are already in the engineering and architect phase of that, so they will get us an exact amount, and we'll know if we have a priority list to work through if we have anything left over of those funds. But of course, our staff and our patients will appreciate the climate control and fresh air.
Thank you.
Thanks, sir.
Vice Chair Wilson.
Thank you, Chairman. Just a quick question. On this MOU, because it is an understanding agreement between the county commission and the mayor, should this go to steering next? Just because it could be considered something that they should review? Will that make the timeline quick enough? Should it go there next, is my question.
I have deferred to the mayor's office on that. They asked very explicitly that it come here tonight, and whether it goes to steering or budget. I think this has been, so I'll defer to the mayor and Eric Hennessy, and even our chairman may have an opinion. But what we don't want to do is
all of those are prior to full commission. I just wanted to see if it needed to make a pit stop at steering, but it does not. Okay. Well, I would move that we would send the MOU agreement to the Budget and Finance Committee with a positive recommendation for its approval.
Second.
Ms. Davidson, any further question or discussions?
Just for clarification, these are funds that you already received, ARPA funds, that you're trying to allocate so they don't have to be returned.
Correct. They already have been allocated in the budget for those purposes. I believe the commissioner's intent was to be sure that the match in some counties did not go away. And I don't know if that particularly applies to our county, but he asked for the participation of all counties in the state.
Thank you.
Yes, ma'am.
With no further questions, as a financial matter, would you call the roll, please?
Commissioner Oliver,
Aye.
Commissioner Davidson,
Yes.
Commissioner Wilson,
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch,
Yes.
Chairman Dodd.
Yes.
Thank you.
Motion passes. Thank you. Director? Yes. Proceed.
Next,
No, I will.
you had, okay.
Bill and I will catch up after
All
you're done.
right. I'll keep my report brief tonight. I really appreciate the attendance of everyone that helped us meet this deadline. Your health department continues to do good work for the people of Rutherford, and we are proud to serve. Hopefully you have your October report, outreach report, made available to you there. As we protect in that first column with our disease intervention, immunizations, environmental inspections. The second column there, we promote with health outreach, diabetes outreach, community participation, vital records administration, and then finally with our primary care services in that final column, dental services, WIC, all programs operational and on track to meet or surpass goals. On respiratory viruses in Rutherford County, we are still considered low according to the CDC hospital admission metric. And all indicators, early indicators and severity indicators are still low. So we are very thankful to be in that place this late in the season. New COVID vaccines are available. Recommendations are anyone 6 months or older be vaccinated to prevent severe illness, particularly those 65 or older or those that are immune compromised. We do have the new COVID shot available widely in pharmacies, doctor's office, and our clinics at the health department by appointment Monday through Friday, 615-898-7880. As I've like to remind you, COVID Test by Mail, that federal program that sends 4 COVID test kits to each household who requests it, is back underway, and that web address is covidtests.gov to request 4 free COVID tests for the winter. There's a phone number as well. It is 1-800-232-0233. And that would give you the test there at home. If someone should become ill, you could at least get a lead to know whether you're dealing with COVID or the flu. And speaking of flu and influenza-like activity is also low statewide, with the exception of the southeast region that just entered the moderate range. We have remained below epidemic baseline longer than we did last year, but we do probably expect a return to that in late December, January. That seems to be our seasonal bump. Flu shots are available as a walk-in and service in our clinics from 8 to 10 or 1 to 3, so no appointment necessary for those, Monday through Friday. And getting that flu shot early in December would offer protection until the end of flu season in the late spring. In other updates, naloxone or Narcan is now available free of charge at our health department in all health departments in Tennessee. So anyone can go to the health department, request it. They'll be provided with an overdose reversal kit and instructions on how to administer that at no cost with no questions asked. As the Chaplain McMurray pointed out last month, that November is National Diabetes Awareness Month, and it's a time to bring attention to diabetes. Diabetes is a disease that occurs when your blood glucose or blood sugar is too high, and it affects about 38 million Americans, including adults and youth. Diabetes can damage the kidneys, nerves, heart, other vital organs. Anyone who is uninsured but has diabetes and needs management or care can contact the health department at 615-898-7880. And finally, in current events, I'm pleased to announce our health department is excited to announce the partnership with a wonderful local charity here in Rutherford County. Archie's Promise has been in Rutherford County now for 15 years. And Archie's Promise does a couple of fantastic things. One thing you may have seen, these organizations that provide formal wear to young people for prom, for graduation, for job interviews at low cost or no cost. And they do that, and that's fantastic. But they have a wonderful storefront out on Woodbury Highway for that. Another place you may have heard them, and I'm pretty sure you have, is that Archie's Promise provides the vending machines that are in some county schools that distribute hygiene products to our Atlas children and then other youth in the schools. That is where teachers or administrative staff can give the students a card with credits on it that lets them go discreetly to a machine and purchase items that they need. Hygiene products such as travel-sized toothbrushes, toothpaste, mouthwash, bar soap, deodorant, other products. And you know the health department is all about good hygiene, so we're proud to partner with this organization. We have agreed to be a drop-off point for them, so either our Smyrna location or our Murfreesboro location, if someone does a little extra shopping, wants to pick up some extra deodorant, things that could supply those machines, they can drop them off at our health department, and we'll make sure they get where they need to go. Archie's Promise has a website as well. It's archiespromise.org. And they have a phone number is 615-427-1816. And folks can donate directly or on their website as well. And it does cost about $5,000 to purchase these vending machines. The director there of Archie's Promise has said her goal is to get those in every middle school and high school in Rutherford County. I know we already have them in Laverne, Smyrna, and Murfreesboro areas. She said she's been approached by other counties wanting them to kind of venture out, but she wants to make sure she takes care of Rutherford County first. So we're there to help her in that endeavor. So it costs about $5,000 for each vending machine and about $1,200 to stock that machine fully. So we're pleased to assist in those efforts that we can help our students and kind of facilitate our citizens to help our students as well. So any questions about that, please reach out to the health department. We'll give you more information about that. That concludes our report.
Commissioner Gooch.
Now, you may not know the answer to this question about Archie's Promise, but if someone was going to donate deodorant, bar soap, whatever, I mean, is it a certain size that fits in the vending machine, or?
They did specify travel sizes when it comes to like mouthwash and stuff. I've seen the vending machines. They do use full-size deodorant. And then what was the other you asked about?
Like bar soap?
Bar soaps, yes. Bar soaps were like the individual bar soaps. They do have a flyer available, and I hope to eventually get that on our website. But if you go to their website, you can see. And another thing they have, if you call, because we don't have the link to it, but they also have an Amazon shopping list. So that might make it even easier for some folks to just go pick a few things, pay it through your Amazon account, and it gets shipped directly to Archie's Promise and then gets in the vending machines in schools.
Okay.
Thank you. Yes. I don't know exactly how to search these charitable organizations on Amazon, but I know the Archie's Promise, their website can get you there, and it's archiespromise.org. And their phone number, let me grab that again. Their phone number was 615-427-1816. 1816.
Relative to the vending machine, has that information been presented to the Board of Education?
I'm
At a
not
board
aware that
meeting
it
or
has.
anything?
I do know that there's a fantastic article on the Rutherford County Schools about Archie's Promise and their vending machines and the Atlas program and kind of the connection there.
They may want to do a presentation to the board, just a suggestion.
Fantastic.
Relative to your vaccines, COVID and flu, what are the numbers looking like as far as administering vaccines?
I would say, our flu vaccines were higher this year than our utilization was higher than it had been any year since preceding COVID. But the COVID vaccine is not stellar, and we would encourage folks to, utilize that vaccine. That can prevent, more acute illness, should someone contract COVID.
There's a lot of it in the population, and I think because we're not measuring it, people are thinking it's not a big deal because you're only measuring hospitalizations.
Right.
But it's definitely in the population, so it's something that I don't know if some kind of PSA, something needs to go forth to let people know it's still out there.
It is still out there, and we anticipate a rise, in usually late December, the whole entire month of January,
Yeah.
you'll see a rise.
And my final question, relative to the dental clinic, what's the turnaround time as it relates to someone that calls today and maybe needed an appointment? What is scheduling looking like?
Scheduling looks like typically a couple of weeks out.
Okay.
But if someone has an abscess or something like that, they can try to get them in earlier, look at that, address the infection. And also, with medical scheduling in general, you will have a no-show rate. So someone can request, and we will try to get them on a quick call notice. Should we
Okay.
have no-shows, that we can get them in quickly. I just want to commend our dental team. We had another stellar month, and we're near the highest in our region as far as patient count right now, and we've come a long way. And they have really embraced a lot of change there, embraced the increased access through TennCare and the governor's emphasis on dental health. So I'm very proud of our staff for doing that.
Is it fully staffed?
It is fully staffed now. We only have one dentist and one hygienist, one dental assistant, but they are operating at a high volume. And we've as a region, Mid-Cumberland region, all health departments that offer dental are now fully staffed and operational. So there's been a lot of attention paid to there, and it's already paying dividends and providing
Great to know.
services.
Great to know. Thank you.
Thank you.
Mr. McMurray?
Director, I have a quick question. I've received a report a couple weeks to come across my desk. The whooping cough cases are on the rise nationwide. Have you seen any cases here, or has there been an uptick in that? And then also the walking pneumonia. So I know this time of year both of those are on the rise.
Both respiratory illnesses and both potentially harmful, and so we have seen pertussis, whooping cough reported. That is a reportable disease. We have seen those cases in the county and statewide. And of course, pertussis, there are vaccines for that, and they could be administered at different times. They're usually administered when a child is very young. They can be administered to a pregnant mother, and that immunity is passed on to the baby. And then there's a 7th grade booster shot as well. So there's plenty of opportunities to protect against that, and that's our best course of action. Whooping cough, if you've never seen it, there are videos online where you can see, a child, and it's really horrifying because they're struggling to breathe between coughs, and that's where the whooping sound comes from. But it's very preventable. Vaccines are, I think I read they're about 85% preventable against whooping cough, but definitely as far as the walking pneumonia as well. Respiratory viruses, this is the time of year to be aware of that. Take every precaution you can.
Thank you, sir.
I'll entertain a motion to approve the report.
Second.
All in favor say aye.
Aye.
Motion carries. Thank you.
Thank you.
Thank you. Have a wonderful Thanksgiving.
Is there happy things?
Byron, was that all? Any budget amendments, or did you want to cover them next month, or did you need?
There's a
Up to
$7,500.
you. Let's do it. Yeah, thank you. Thank you. Thank you.
Okay.
Thanks for that consideration.
Yeah, well, we did send a flurry of documents. At being the end of year, we do have some cleanup to do. Again, I appreciate your patience with us and your support. So What is the first one you have there? Is it the amendment to move funds, the 7,500? Okay. So that's a budget amendment to move the 7,500 in grant funds for the video interpreting service to a 599 account so that we can utilize those no-match funds. And that's for, I mentioned last month, that's for a video interpretation service that's iPad-based, and the county courts are currently utilizing that, and that would just give us just a little more so we could see more patients than we have in-person interpreters to use.
Second.
Any questions or discussion? Call the roll, please. Byron will.
Commissioner Oliver?
Aye.
Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner McMurray?
Yes.
Commissioner Gooch?
Yes.
Chairman Dodd?
Yes.
Thank you.
And Director Cumbie, I'll let you get oriented and you may
Okay.
proceed with everything that's on the SharePoint.
All right, I believe everyone can go back one document, and that is the amendment to the grant contract. And this is basically not going to affect the money. It's going to extend the contract period. So this was a grant contract, and I mentioned we had two pots of money. This one was $340,500 with no match, and this was to extend the contract year. Instead of expiring this coming July 2025, it'll extend it to July of 2026. And that's one of the projects I was talking about. We're currently in the engineering and architecture phase, so that would give us another year and a half to complete that work.
Second.
Any further questions or discussion? Call the roll, please.
Commissioner Oliver?
Aye.
Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner McMurray?
Yes.
Commissioner Gooch?
Yes.
Chairman Dodd?
Yes.
Thank you.
Right, and we have our county co-op agreement. It is the next to last document there. And that is our annual agreement that I bring to you every year between the county and the state. It outlines the state and the county's participation in delivery of healthcare services in Rutherford County. We did have Finance Director Smith review it for accuracy. He has updated it with the current figures. And the county's contribution has remained the same as last year in this document, this year's document.
Motion to approve.
Further questions? Everybody caught up? Call the roll, please.
Sir. Commissioner Oliver?
Aye.
Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner McMurray?
Yes.
Commissioner Gooch?
Yes.
Chairman Dodd?
Yes.
Thank you.
All right, and lastly there, the final document is the Health Department contract amendment. This is something that does tend to occur every year because we signed that contract. I believe it passed commission in August of this year, but then they adjusted the amounts to accommodate the county raises. So we are just basically aligning the state grant contract with funding the raises that were received after that contract was approved. Director Smith has related to me that this has no impact on the county budget, as he did anticipate and accounted for the changes in advance. And so this is just updated for accuracy in this document.
Have a motion, a second. Any questions or discussion? Mr. Phillips, call the roll, please.
Yes, sir. Commissioner Oliver?
Aye.
Commissioner Davidson?
Yes.
Commissioner Wilson?
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch,
Yes.
Chairman Dodge.
Yes.
Thank y'all.
Thank you, Ms. Hill, and thank you, Director. You may not have to come next month. The next order of business and so acknowledged, and we'll make sure Ms. Hill and make that happen. Thank you, Chairman. The next order of business, I'll move up the agenda and ask if Vice Chair Wilson has looked at the minutes.
Thank you, Chairman. I have reviewed our minutes from the October meeting. I find them to be in order, and without objection, I move for their approval.
All in favor say aye. Any opposed? Thank you. Thank you, Vice Chair. Community care minutes, if they're not on your SharePoint, they are in the SharePoint under the CCR heading. I noticed that I think 9 employees have been hired in the medical field there. They still have some openings. Commissioner Oliver, I did note that there seemed to be some COVID cases on the rise out there, so your observations are accurate in that regard. Otherwise, check out the minutes. On to school board, our final item, and Dr. Sullivan's schedule changed, and he and I were talking this morning, and he asked, could he come? I said, please do. So thank you. Thanks for being here, Dr. Sullivan.
Still working, so I figured, why just not come over and say hey. Not a whole lot going on as far as our schools are closed this week. Our enrollment's 52,300 kids, so very similar to what we had previous month. Lots of things about to occur. We have our final rezoning meetings December 3rd and December 5th. Our board last year approved our new rezoning plans with the caveat that it had to be revisited 6 months before implementation. And so that will be a presentation of our new enrollment trends, new boundary lines. I do not anticipate elementary changing from what was proposed last year. Middle is not necessarily going to be adjusted. We don't rezone middle school until we hopefully get approval for the new middle school, so it's 1 year off. And then the new high school, or the high school additions, are the ones that come online this year. And so we had to look at the Blackman-Siegel area that is right now going from Blackman to potentially Siegel. We need to look at that. And then second, we need to look at areas of downtown Murfreesboro and make sure we have all of our seats that the county commission approved for us to have additions, those filled. So we'll have some modifications to downtown that we'll present December 3rd and 5th with our same consultant we've been using, RSP, and then hopefully vote on it December 10th. And so that is a big area of focus for us. Number of teaching openings that we have is around 40. That is partially due to our number of English as a second language teachers that we hired back in November and posted. We have some retirements around the second semester of the year, so we're posting for those. And then the last portion is special education. We're continuing to really struggle to find special education teachers. It's a common trend. Excuse me, it's one that unless you have that degree, you can't get an emergency certification. So somebody has to have that degree to teach special education. So.
Thank you. And I do remember, Trey and Jeff, when the openings were in the dozens and dozens, if not, I remember 70 in the 70s.
A couple hundred in August of 2022, so it's, yeah.
That is good news. And I was going to ask, so the same consultant's doing it, so you did answer that question, thank you. So you'll have that guidance and that professional presentation from those guys.
Yes, we will.
Very good. And no budget amendments, so thank you for that. So thank you for that report. We'll have a motion to.
I did have a question.
Any questions?
Honestly, not directly related to your report. I was just concerned about the person that went into our school with a gun. And so I was wondering if that staff had any kind of training or remediation to ask for ID and all of that before allowing somebody into the school.
I'll have to go back and review what you're talking about, Commissioner Oliver. Sorry, I'm not.
I mean, it just happened recently. The person went to Pittard and then went to Siegel, and had a gun, and they ended up having to find his license
Were not
plate
our
to figure out
schools.
who he was.
Those were not our schools.
Siegel's not?
Siegel Elementary, no ma'am, it's not.
And what Commissioner Oliver is a person purporting to have a sibling that he was inquiring about where this sibling needed to be enrolled, left one school, left Pittard, went to Siegel, and either Siegel or the folks at Pittard observed on his departure that he was carrying.
Right.
Schools, despite the carry permit, schools are no carry zones.
That is
Right.
very,
Did he leave both schools without being questioned?
yes.
So it was a
And so they
disturbing-
had to figure out who he was by his license plate, as opposed to the fact that they're supposed to present an ID to enter a school. So I was curious, and I know Mr. Evans made a comment about it, and so that's why, if it wasn't Rutherford County, then why did we have to have a soft lockdown or have a comment on it?
Because we got asked about it by the media. So
Okay.
that was why. It is very confusing that Siegel Elementary is a city school when Siegel Middle and Siegel Higher County schools. But because our schools are in such close proximity, anything that impacts the school that close, we usually get asked for a statement.
Gotcha.
Now I understand.
And,
Gotcha.
and we have what is the card reading system?
Raptor.
Raptor.
Yeah.
Does the city schools have the exact same program? I think our Raptor has had a pretty good success rate, so I'm
Yeah,
glad
I
it
was
wasn't our
just gonna-
folks that were challenged with that.
Yeah, and I had some people reach out to me about it, and I'm like, but we have a system, you know what I mean? So, yeah.
Thanks for questions, just to
Thank
have
you.
that out in the public that we're aware. Commissioner Gooch.
Thank you, Mr. Chairman. Dr. Sullivan, this is an FYI. Commissioner McMurray and I and School Board Member Rossell had a town hall meeting, and sending Blackman kids to Siegel was a very hot topic.
Figured it was.
That was just an FYI.
So one of our proposals, I've notified our board that we've asked them to look at, was that it'll be a dual zoned area because Blackman High School is too overcrowded. Siegel is not. But if a parent wants their child to continue to stay at Blackman, they can provide transportation. So that is going to be what our proposal is. That should hope solve the
Okay, thank you.
best of both worlds, but totally understand.
And thank you for working with the parents.
Absolutely.
I know.
Yep. Our biggest issue there is we hope to, within 3 years, open a new high school, and we didn't want to rezone kids their freshman year and then rezone them again their senior year. Because that area, I know that's y'all's area, I'm sure will be impacted by a new high school.
That is a huge, onerous topic, so bless you. So we will just, a motion to approve the superintendent's report. All in favor say aye. Any opposed? Dr. Sullivan, thank you. Did you have anything else to report? And thank you for
Heading back over.
good luck back at work.
Yep, thanks.
See you.
Go Vols.
Come back. We have a rebuttal.
Yes, no, it's not a rebuttal. I do want to admit that our county finance director and myself almost debated coming to your community event and demanding public comment, but we decided against it. So.
Well, next time you will personally be invited and expected to be there.
That concludes our business. Is there any new business? Everyone, again, bless you. Thank you for being here. Have a wonderful Thanksgiving. I hope you get to enjoy friends, family, and loved ones. And we are adjourned after Commissioner Wilson has a comment. Thank you. I should have a note. So our next meeting is, no, that's public safety. Isn't it? Our next meeting is moved to Tuesday, December 17th, as opposed to Christmas Eve. I will not be here on Christmas Eve. So don't forget, next meeting, Health and Ed, Tuesday, December 17th, in these chambers at 5:30 p.m. Thank you, Vice Chair Wilson. If no further business, we are adjourned.